All right. Thank you so much, Max, for being here and donating some of your time to help uh, new MFT students kind of understand this world of working with older adults and their caregivers. I know this is an area of research and clinical expertise for you. And so I'm going to give you a second to kind of introduce yourself and the kind of work you do, and then we'll jump into the topic.
Yeah, sure. Well, thanks, Katie, for having me. Yeah, so I direct the medical family therapy program here at St. Louis University, obviously a colleague of Katie's, and I know we have talked a lot about aspects of caregiving in different senses and different topics. Yeah, I got interested in geriatrics and caregiving in my doctoral work at University of Minnesota. They had a family caregiving clinic there the first year. And so I got to observe some groups and see how research was involved. And I was pretty much hooked from then on and kind of arrived at it much more too when I got to observe in the medical setting what that was like and got to see how research can adapt from it and looking at different interventions you can work with caregivers and family members there too. So then that led at SLU developing the memory clinic that's been going strong a little over 4 years now. And it's been taking off obviously during the COVID pandemic. And we've gotten a lot of groups, which I know we'll talk to later. And we've been doing some interesting research on, pre-post measures on isolation, on depression, memory improvement, and caregiver well-being as well. So yeah, a lot of stuff around this topic is certainly relevant.
Yeah, well, it sounds like you're sort of involved both on clinically sort of how to intervene or what to be looking for, what to assessing those pre-posts you just talked about, as well as understanding maybe through research of those interventions, what works, what helps, what makes things better. You mentioned memory there, and I know you typically work with folks with dementia, is that accurate?
Yeah.
Yeah.
Yep.
And their caregivers. So can you talk a little bit about why you include their caregivers in the work, and maybe some important things for new MFTs to understand about them?
Yeah, sure. Um, I think in the MFT literature, we learn a lot in family therapy and thinking systems, working with, kids, teens, adolescents, adults, couples, and later life families. But in the oldest old or end of life, we've really kind of neglected that area a lot in the family therapy literature. I think more has been coming about there, and where caregivers' health and well-being and even coming into therapy more, we're starting to see that a lot more. Variations of caregiving has really spanned different ages. It's different culturally too. So I think we're not only starting to see that clinically, but also in the research, we're starting to see some interventions and outcomes in what works best. In the dementia population, I think caregiving is absolutely essential to address. Dementia is really a family-centered disease. Even though it's afflicting a person who has memory loss and neurocognitive decline, the caregivers usually going to be the one, whether it's a primary or shared caregiving, to help that person with their activities of daily living, trying to improve their memory at home, even just trying to help motivate them to do things after a diagnosis, because
Mhm.
it's really shock value when someone gets a diagnosis of Alzheimer's or a different type of dementia. So I think having a family-centered approach is absolutely crucial. But then it's not only the person diagnosed, but the caregiver's health. Yeah, caregivers are often the silent patients in healthcare,
Hmm.
and we really neglect what they go through. But in a decade from now, there's going to be 1 in 3 adults who are going to be the primary caregiver of a loved one or close member. So it's just not a matter of if, it's when that we need to address this. And as we've mentioned, caregiving for the older population, we don't think about a lot in caregiving. So.
Yeah. It sounds like we're going to have to start thinking about it based on that statistic, 1 in 3. And if we don't, at least as a society, we could have a lot of very stressed families as a result. Um, what you were
Yep.
when you were describing that, I was thinking in my head about when my grandpa got diagnosed with Alzheimer's, and then watching my grandma sort of respond, and
Mhm.
trying to sort of be the one who has it together all the time and be the one who's staying on top of things. And of course, she was, as old as he was, which then required my aunt to come and be another
Right.
caregiver, right? To relieve some of that stress and even her like lack of mobility. And so I'm thinking about these sort of multiple caregivers, even around one patient.
Yeah. Yeah, that's a great point. And it kind of lends into two things. One is how we define caregiving,
Mhm.
because a lot of times it's assumed in family that you're going to have generational themes of a spouse takes care of their loved one, or the kids will move up and be able to do that. But as we become more globalized as a society, we become separated distance wise. So when there's shared caregiving, whether it's long distance or a family has to come together to take care of someone, those dynamics of how a family operates in caregiving has changed dramatically.
Mhm.
I always tell caregivers in our clinic, you're not doing caregiving as much as care working, because it's really it's a thankless job, and you don't get compensated for it. You lose time from work.
Mhm.
It's an enormous effort that people take out,
Right.
and you think the return is the love and hopefully the understanding from your partner, loved one you're taking care of, that they appreciate it. The problem with dementia is when they lose memory and they don't track that,
Right.
there's that ambiguity of, are you getting reciprocated back? So it's a big challenge, especially when you're taking care of those with memory loss or older age.
Yeah, yeah, yeah. You're making the other place my mind went to was, so my grandpa sort of maybe doesn't know to be appreciative or thoughtful in return as a result. The other thing I thought about was my aunt's husband and his reaction to her sort of dedication to her parents. So much so that she moved from one town to another just to be like next door to them, quite literally. Um,
Right.
because of all of the care that was needed and what that required of her sort of family unit in terms of becoming a more available caregiver at that time. And so
Yeah.
sort of systemic like ripple effect of the diagnosis across the family. And then, yeah, and then dealing with everybody thinking maybe you as a caregiver should be doing something different. I don't know how much you've seen that with caregivers, but they get feedback from other people about what they should be doing or
Oh yeah.
care or whatever, and feeling
Oh
pretty.
yeah. Absolutely. The caregiver process groups we have in the memory clinic, I mean, they can go off for hours just on how much they try to listen to advice from family and friends versus they don't understand what I'm going through,
Right.
and they're not in the thick of it at home. Yeah, they do that a lot. And yeah, your example you said also made me think of, like, with contextual therapy, where we think about like morals and values in families and what we owe each other in the context. And I think caregiving is a lot of that. It's, as things get passed down to generations and you think about who's going to take care of whom and who's going to be there, it's almost like a pay it forward, or what are you going to give in return
Yeah.
for family. And I think one of the biggest misnomers is a lot of people don't want to take on the caregiving role,
Mhm.
because there's family dynamics, and there's plenty of caregivers who are thinking, if this was my choice, and it sounds terrible, I'd have him or her, in their own separate apartment or place, and I can finally do what I want to in my life. And then that gets into, am I a bad person now for thinking that? And it starts to snowball. So there's a lot of those thoughts and worries and fears that go through people with caregiving. But the motivation of people wanting to take that on and give it to their loved one, you can't assume that they want to take that on in the first place.
Yeah, you just had me think there's a concept in contextual about legacy. And so
Yep.
depending on the legacy of relationships, both intergenerationally and then in real time, the degree to which I feel like this person who needs caregiving has invested in me might be the degree to which I want to return the favor, or like what you were describing,
Exactly.
paying forward. But what if our relationship was terrible and conflictual and this parent was really mean to me? Like
Yeah,
maybe I'm not,
that-
or abusive, right?
it's a great point.
Like
Yeah, no, that's legacy is huge, and even now, I think one of the biggest challenges, especially that children of their parents who have memory loss or health issues later life, is how much do I want to keep them in the home and go over there and take care of it versus find assisted living or long-term care facilities so that they can be taken care of and I can still get back to and manage what I want to in my life. Those are things we don't think about a lot is, the place where we take care of someone and the time commitments that we have. Because, even some family may have to adjust bringing their loved one into their home or vice versa, where they're spending considerable time at a family member's place. And like you said, that might be one of the last people in the family that they want to be able to help and support, which we hear plenty of those stories, but it happens. It's just real life.
yeah, yeah. Well, yeah, yeah. I'm just thinking about like it just reminds me of when I think about my own training where we talk about family conflict, or we talk about caregiving, but mostly in the sense of children caregiving. But the
Yeah,
children haven't heard us yet. Speaking of them,
right.
they also do not reciprocate love all the time. But it's an expectation, right? They're children, so of course not. Whereas with an older adult or a parent or a partner, the expectations are just really different. And the relationship has had years of who knows what leading up to this
Right.
moment. The other thing I thought about in there was the issue of finances in families as it comes to caregiving. I imagine that's a common topic.
And money's a big issue. And, where we hear caregivers in our groups or when I've worked with them in practice in the past where someone's behind on bills, if you're trying to allocate money to put a loved one in a long-term care facility, there's a lot that really adds up, and even what they have to sacrifice for their own finances are important. Even when we're working at St. Mary's and in the hospital or at family care or any of the places where you're working with caregivers where a loved one has an immediate issue or diagnosis, we always talk about power of attorney. Do you have a healthcare directive? Because that's something that often gets lost too, because caregivers sometimes don't know the legal and ethical responsibilities that they have for a loved one to take care of them. I mean, certainly the bills and the shopping and transportation, I think that goes without saying. But if their loved one really runs into an issue and they need to pay for a hospitalization, or if anything comes up where there's a medical decision that has to be made, do caregivers really know their rights around that, not only from a money standpoint, but from a legal standpoint? And a
Yeah.
lot of times they don't.
Right, right. And then how much planning has maybe the patient had in place to be able to handle this moment? I've noticed, at least in my own work, and I think about even just people I know and in my family, how much of a resistance there is to address later life or end of life stuff, that there's this
Yeah.
discomfort maybe with facing inevitable physical decline or death. Um, and so when there is a diagnosis, it might be particularly shocking because nobody's done anything up to this point, even if the person's long into their 70s or 80s, um, just
Yeah.
because of discomfort in addressing the topic at all. I don't know how much you've seen that, but
Oh, a lot. And a family actually comes to mind when we were rounding at the hospital a few years back, and there was no primary advance directive for a caregiver. It was a mom in her 70s in the hospital, and she had to have a life-threatening procedure done. And she actually, a few days later, went into a coma
oh, wow.
because of that, and because they didn't have anything set up and the family hadn't talked about things ahead of time. The doctors and everyone had to just work medically on her in the moment, kind of doing a full code. And the family said, well, we didn't agree to that, but there was nothing in writing. So you know, when there's more advanced things like that, that would be a more serious example. But I think it goes back to family communication, I think is essential with
Mm,
caregiving. And if you're not talking not only to the primary caregiver, but having help from a family system, it puts so much gravity on the main caregiver to have to take care of all these responsibilities and things going on. And a lot of them just say, well, I'm getting back to my second job tonight of caregiving. Once I'm done with my financial job during the day, I have to go to my second job at night here. And
yeah, I
so they
mean,
see.
I have to imagine for a lot of family members who do caregiving, it probably feels very 24/7, 365. Like there's not a moment where that person doesn't need, unless you maybe work in other folks to give you reprieve, like a weekend off or something like that. It's constant.
It is.
Yeah.
It really is. And I think that that's where people are coming into therapy a lot more. And you're seeing this clinically is the burnout becomes so severe for caregivers that you know, they're talking about not only ways that they're trying to cope through depression or anxiety, because those can be really high,
Sure.
especially in the 3, 4, 5 year mark where people are in kind of the chronic phase of caregiving, but just also decision making for what to do. And I think where families are trying to address later life health issues and determination of what to do. We're seeing that a ton during COVID time, where how safe can I, you know, place my mom or dad, you know, transition them out of the house or even go over there and help out. So it's there's a lot to weigh.
Well, and in some ways, I have to imagine the current historical moment has really shrunk the options available to you, or at least made you more wary of some of them in terms of the safety, what it means for, older folks are in that high risk category when it comes to COVID. And so that must weigh pretty heavily on caregivers.
It does. It does. We've seen that. You know, one of the groups that we started, Circle of Friends, is to reduce isolation and loneliness for older adults. But even a portion of them are caregivers themselves
Oh,
for
wow.
others. So it's interesting to see that. But yeah, we during this time, it's just been fascinating to see people really be resilient in not only their caregiving, but in being able to reach out to family or people really being isolated
Yeah.
and feeling like they're on an island taking this on their own.
Yeah.
So I mean, family systems in caregiving is just it's a perfect synergy, because if you're not using your system to really help support you during that time, or you feel you close off people for a reason, it just tells a lot about how connected you are with your family, with your community, you know, other social arenas that you have.
Yeah,
It's
now
really
that you bring
telling.
up that word resilience, it seems like there's a number of things you've shared that would fit into from a Walsh's family resilience model, where she
Yeah,
talks a lot about family communication being quite central in terms of being able to say what you need and share, express emotions, and think about your groups, like being able to kind of look at each other going like, right, this is really hard. Like just getting to do that and not be alone. And then another
yeah,
part of it, she talks about sort of resources available to the family so that I can call, like my aunt would call up my parents and say, hey, I need Saturday off. Can you come hang with dad? Right. That she had people she could draw on to give her a break when she needed it. But that was
yeah,
central to her own well-being and being able to sustain the work for, man, how long did she do it? 5 years. You were talking about that
yeah,
burnout, right? But in some ways, I just hear you like it seems like it fits into her, systemic model of resilience that is about these multiple connections and processes that need to be in place for a caregiver and the family to be resilient during a really difficult, stressful time, and a time
yeah.
that's extended for months and years and God knows how long.
Absolutely, a great point. I love Froma's model, and I always like when she frames just even the word resilience,
Mm.
that it's a long and constant state of having resiliency. It's not that it goes in a phase and it phases out. It's that it assumes we have that mechanism in us and the family has that. And it's a way of how does the family organize itself across time
Mm.
during different stages, because there's going to be different time points that happen where the family is going to have to endure crisis situations. So, like you said, the organizational patterns, belief system, different areas of, whether the family, is believing that what they're doing for around a crisis situation or around taking care of a loved one, they're all on the same page with.
Mhm.
I often find the beliefs and spiritual part pretty fascinating too with families, especially now, and how they view what to do with caregiving and with someone who's aging, giving people autonomy to age, whether the family helps and rush to that, medical decision making. So there's just a lot that weighs in. So you're absolutely right. Fromm's models are really good fit with
Yeah,
caregiving.
spirituality's got to be a big one. Religious beliefs. As I'm thinking, and I'm a pastor's kid, right? So like that's my upbringing. But there's a lot to be said in most major religions about end of life and what decisions you sometimes even what you should do. Um,
Right.
so and then like most families, there's people who stay devout, people who leave and join other religions or none. And so I have to imagine that introduced maybe some conflict about what should or shouldn't happen, or at least might direct some of the decisions that are made.
Oh, absolutely. I mean, in my family, coming from a Jewish side, my dad's side, Catholic side of my mom's, I can certainly attest to the spiritual conversations, growing up and how that impacts, our views on things. But yeah, spirituality comes up so much, and there's a term locus of control that caregivers have. So, do they have an internal locus of control, thinking that they can take on all of this and that their loved one is able to make decisions through a health condition or something going on? Or if it's external, where they just give it up to a higher power and it's out of my hands and it's at the fate of whatever the universe or God or anyone determines is going to help out my loved ones. So that's been also a very fascinating dynamic that caregivers have, is not just the expectations and the duties of it, but kind of from a broader viewpoint of where's this going and how do I want to fix my life into my family member, friend, or person that I'm caretaking for. So
Yeah,
comes up a lot.
you said me think of what I grew up in an evangelical Lutheran home, and what they would say was, "It's in God's hands now," and it was like,
Right.
and I'm like, "But can we do something?" But like, I get it, but also that issue of internal locus of control. I thought about like, does the person think they have agency over the present moment, that
Yeah.
they can make decisions, or does it feel very out of their hands? And at least from the research I've seen on religiosity, there's usually you need to have some balance of the two, where you don't try to control everything or think you can
Right.
control everything internally. On the other hand, thinking everything is external, then you're just sort of like gonna lay down and take it. Like there's got to be some middle place here. um
Right. Yeah. If you ever figure that out, let me know to pass along to the groups. We have fascinating conversations in our groups around that, and you know,
I
I
I
mean,
know a religious scholar who might be willing to come in and talk to them, because one of his big areas, I got to work with him during my master's program, and he talked a lot about like thinking about spirituality from a relational perspective, a systemic perspective. He's a trained MFT but turned religious scholar, and so like he thinks in that realm, and then this sort of balancing act of external and internal, and how do we understand both for ourselves but not end up like giving one for the other, and
right.
in the ways that most extremes don't work out very well. uh,
Yeah. Well, and it's a good point. I think there's just, again, not only the definitions are expanding, but I think the more we know on this topic of just what caregiving means in people's lives,
mm,
and again, whether it's research in the media, where we're kind of just learning more, I think we're just expanding to kind of know more about what we want in the world and in relation to our family and what we want to do.
Yeah.
versus, decades ago, again, it was an expectation from our parents and grandparents of, I don't want to say a more of a hardline approach, but just the lack of information there or options
Yeah.
even for care. It was there. You take care of your loved one in the home, and family is close by, and you can rely on them. And in 2020, you have 7 families in 7 different states, and you have to negotiate how that works. And society is just totally different now.
Yes. If you want to hear something terrible, we've already started negotiating who's getting my parents because none of us, between me and my siblings, none of us live near them. And so there's this running commentary, but like joking at this moment because they're still able-bodied and nothing happened yet. But, like it won't be long before we're going to have to make a hard decision. And I think starting the communication now to me seems like a good idea so that it's kind of clear. Like at this point, I've sort of volunteered myself um, as the oldest daughter, and maybe that's part of a cultural obligation to take in. And I have to imagine, you mentioned earlier there that this idea of meaning of caregiving. And I'm thinking like therapeutically, how helpful it would be for caregivers to be able to have a purpose or a meaning behind their work beyond I have to, beyond like obligation, right? Like that's not inspiring. I have to do this. It might get us to do it, but we don't feel good about it in a way where if there's a spiritual reason or a family reason or a cultural reason that matters to us, then maybe at least that's part of Froma's model too, is about meaning making in adversity. That if we can make the meaning of it that sustains us, that would be therapeutic in some way for them.
That's a great point. And by the way, I do always believe in sibling position. So I think there is an element of truth that Bowen had on that. So I totally get it. I mean, not fully, but it's with with caregiving. I mean, that can definitely come into play too. I mean, a lot of families think, it's next person up or who we think responsible and doing all that. But yeah, the meaning making comes up so much. And I think also where we tell caregivers in our groups that you get to define the meaning you want. It's not that there's a universal truth of what caregiving should be or taking care of somebody. And Pauline Boss talks a lot about that when you're taking care of someone with dementia around, she uses the term delicious ambiguity, which I think is interesting. So it's like it's where it's so ambiguous that becomes really a huge gray area around what are you doing, and times are really rough, and you don't know with working with dementia whether or not the person's tracking you or not, but you embrace the successes and you make your own meaning around how you want to define your relationship with that person. And that can change multiple times. So it's not just fixated saying, I'm, this person for my loved one or friend. That can always, and one thing I also thought of was with spousal caregiving, there's always the challenge of, is my spouse thinking of me as a spouse or as a caregiver? So caregivers play different hats in, okay, am I husband, wife, or partner now, or am I the medical health caregiver in a role? And sometimes that's really difficult to negotiate, which hat you're wearing and how your loved one is perceiving you. Even with children too, we hear that a lot.
Yeah, well, for me, that brings up sort of like also the ethical part of this. Like, I've heard folks with partners with dementia go, do you still have sex? Do you not? Can they consent? They're acting like they can consent. Are they coherent right now? Like just all the questions that come up and the affection that might really be desired by either of them. I imagine that comes up too, that's a pretty ethical, ambiguous place.
Great point. The sex and intimacy and closeness it's a very underrated topic that the groups do talk about a lot. And it's kind of, if I'm trying to be intimate with my partner, or even if I just want to be close to them, we had it was sad to hear where a gentleman was declined so much that his wife was trying to, just cuddle with him on the couch. And he was reading something, and he looks over and kind of got frazzled and said, you know, do I know you? Do I still know you? And she was trying to have some sort of closeness, and he's not tracking what's going on. And I mean, it was kind of even just kind of a lower level of just, connection and intimacy. And so even those things become difficult, um, let alone when, partners want to be more physical. And then there's a lot of different interpretations with someone with memory loss, and even someone with chronic health conditions, where they have to try to negotiate that's a big topic.
Yeah,
Yeah.
I would think so. Like, at any given moment, kind of who are you to me, and then what can I reasonably expect? And then the
Right.
surprises that come, like what you're describing, like that story, it's heartbreaking. And maybe not that unexpected given where he was at.
Right. Right. Yeah. And again, I think caregivers just have to have reasonable expectations around the connection that they have with their loved one around it. I mean, probably dementia being the clearest example of that, but um, again, the sacrifices are just enormous. And, if there's in-home equipment, if there's medical devices, if there's medications, transportation to and from appointments, there's just a lot you have to track based on the severity of what's going on there. All while you have to come back at the end of the day. And if you're the child or you're the partner or a close family member, you have to play that role as well, and making sure you're taking intentional time for that as a family member or close person to
Yeah.
that individual.
Yeah, that makes a lot of sense. Um, so I think we've covered a lot of the big topics I had. Is there something we haven't talked about yet that you think is important for MFTs to know about working with these families?
So, one thing I've really learned differences in families has been cultural norms and perspectives around caregiving. That to me was one of the biggest learning lessons for me. Obviously, it's, the saying goes, when you're undergrad, you think you know everything, master some things, and doctoral program, you understand you don't know a damn thing. And so, for me in my PhD program, when I started to get years of being able to work in the clinics with caregivers, I started to see the cultural differences of more families doing shared caregiving versus a primary caregiver. The meaning of stigma and what that plays as far as if a person doesn't want to caregive, and how the family perceives that within that system. And and just some of the variations of how families take care of one another, even more from a sociological perspective. It's really fascinating. And now in my work, and to get the benefit of supervising a lot of students who work with caregivers, they'll bring that up, and just, I didn't realize that, working with a family where six are living in the home together, arguing and, talk about what they want to do and not do. But it's, you have.
Oh, are you still there?
Oh,
There
sorry,
you
did I cut out?
Yeah, cut out for a second. It's
Oh,
okay. When you were talking about culture, I was thinking about, I have a couple I worked with. They are first generation immigrants from India, and Hindu by faith. And in that culture, I didn't know this, but in that culture, the oldest son is supposed to take care of his parents. So they wanted to continue this in the US. So the parents looked at the oldest son and was like, you know,
yeah.
so now is the time when you are supposed to be letting us live with you. So he did, but his wife, also Indian, but culturally American, was like, no, 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 I'm not comfortable with this. Well, the parents move
Right.
anyway, and then it's a hot mess for 10 years, like a hot mess for the whole family, including the other siblings and the couple, the husband and his wife, and the parents. Um, and so that there was all this infighting, what you were describing there, like all of this, like, but that's the expectation, but I don't want to, but I have to. And then all of this conversation about finances and money as a result, because if they don't live with us, then where are they going? Um,
Right.
and culturally, that was all news to me. I'm not as familiar, right, with that culture. But then for me as a therapist, trying to work within that frame of like, well, that's his obligation. So I can't come at it as an American going like, well, independence and, you should do this, right? Like I had to fit within their frame of understanding how this is supposed to go.
Great. Yeah, great example. And yeah, I think you really just have to meet families where they're at. And it's just a reminder that whether it's caregiving or just a family bonding, every single case you work with is fully unique. And yeah, when I worked with in my doctoral program, a Hmong family,
Mm.
it was a wife who had four daughters, and all five came in for a session, and she was really down and she was crying, and I could tell that she was just emotionally really flooded from what was going on. Her husband, very hard worker, but he had a chronic kidney disease, and so she was taking care of him at home, and I had kept using the word depressed and her feeling depression, and she said, in the Hmong culture, um, I didn't understand on my charter when I saw things, and my doctor said the word depression. We think of sadness as far as what I'm going through, but I also didn't feel comfortable or allowed to show my emotion.
Mm.
For me, it's a responsibility I have to, to my family, just to keep going. And, I learned that from my parents, because my mom was a, strong woman to my dad and to the family. And so that was really tough because I thought, I want to honor obviously what she's going through, but I know emotionally she's also going through a lot. And obviously, from a white male American perspective, it's, I want to help you, but I also want to understand where you're coming from in this situation. So,
Right. Well, and maybe like if the emotionality is that pent up, like she has to hold it together for so long, the expression in your office makes a lot of sense, but maybe
right.
worse than it is or looks exaggerated in some way because she's been waiting so long to have a place to kind of let it go.
Yeah.
Mm.
Yeah, exactly. Yeah. Culture has really been one thing that's really, opened my eyes a lot to that. And I think another area too is where people are finding resources or getting help, and using whether family or a social network. That's really adopted over the years as far as using technology or being able to find other resources. When we've done a lot of research on what caregivers want after a loved one is diagnosed with, let's say, dementia, one of the main things they say from their healthcare team is they're not providing me enough resources up front with how to handle this or where I can go from there. A lot of caregivers we hear in the healthcare system, it's here's your 3-month follow up. Take care of your loved one until they can get another medical checkup, and good luck. We'll give you some information. So maybe not someone as a therapist right away to talk with, but at least a support buffer or someone that can lead them. And that's why, I mean, I think MFT's role in this is going to be vital in the future, where we need to have a workforce development that's addressing not only the older adult population, but families, whether it's in healthcare or in, private practice community settings around this, because it's just going to increase the numbers of
Right.
people needing help in situations. So,
Right. Oh, absolutely. I mean, yeah, I mean, your beginning stats kind of scared me for a second about what all's
yeah,
coming next. Because
yeah,
yeah, I mean, it's going to be important. I imagine too that MFTs are plugged in different places and have a network of resources they know about as well. Because I will say one of the things that I I remember doing early on as an MFT when I first started working with all different kinds of families was, yeah, I don't know where to send them for that. Or no, I don't know a lot about that. And then going to my supervisors and being like, do you know anything about? And then
Right, right.
creating my own resource pages, like literal Word documents full of stuff for different kinds of scenarios, including this one, that knowing what's out there, even on the web or large organizations that support, caregiver networks or that
Yeah.
kind of thing, that's really important to being helpful in these moments and to being useful.
Yeah, absolutely. I tell students a lot. I mean, you're not only going to have the hat of a therapist, especially when you're working with caregivers, and especially if you're working in the medical family therapy world or in healthcare. You're going to be a coach. You're going to be a navigator. You're going to be a facilitator.
Mhm.
Sometimes you're going to be a connector, collaborator for families to talk with other providers as well too. So the therapy part, and I think our systems training is going to be a huge benefit for us in the future. I think we offer that where I think there's a lot lacking still out there for caregivers' needs, but I think we have to learn a system we work in is not the system only in front of us. It's our system of providers and professionals we have to work with,
Mhm.
especially with caregiving. It really takes a village to work with caregivers because they need so many resources in so many areas. It's
Yeah.
endless.
Yeah, I would think so. And so being knowledgeable about that and connected and networked in some way. I know we say to students all the time, like, go network, go meet people. And they're always like,
Yeah,
what? And I'm like, no, because then they become a resource. If you need something, you call them or you email them, or as one therapist here in St. Louis did, found me on Facebook and messaged me about something, right?
yeah,
But all that becomes helpful because we know each other. And I go, oh, hey, Heather. Yeah, sure. Happy to provide, right? Like it becomes collegial, and you can have, I mean, I consider them friends in some cases, right? Where you work together around families, and it's not needs to be an isolated private practice office scenario, because that doesn't help
completely,
families.
completely. Oh, I completely agree. I mean, I think, therapists, we need to practice what we preach to caregivers around if we want you to connect to other people and utilize resources, we need to do that as professionals too, and help that. And again, I think, caregiving and therapy, one of the great benefits is you can do so much work. One of the biggest challenges is it's a lot of work. And so you have to always have people kind of at your disposal to say, hey, if you need to talk with a case manager that's connected with your loved one's care, a doctor, a psychiatrist, even an activities director in the community who can help with getting your loved one connected socially,
Yeah,
whatever it is, it's vital because if you try to take on so many things with a caregiver, you're going to wear 5, 6 hats at once, and it's not an easy job.
yeah,
So,
absolutely. No, that makes a lot of sense. Um, anything else? I know we're at about 45 minutes, so I don't want to take up too much of your time, and I appreciate all the wisdom you're sharing with us. Any
yeah.
last closing thoughts or words of wisdom for our new MFTs?
And no, I always put a plug in for the memory clinic, free advertising. Yeah, we're running some interesting things with the social connection group, Circle of Friends,
Mhm.
cognitive stimulation, caregiver support. So, if students want to volunteer, they're happy to. Any
Awesome.
community members hear this and want to give referrals, they can. And yeah, I would just encourage people to always think about not only when you're working with families or older adult couples or families, that there's always going to be a caregiver or someone taking on responsibility in there. And
Yeah.
keep educating yourself a little bit more on just what are the basic needs for caregiving, because it's going to be the norm, not the exception, in the coming years and decades. So
Right. Can't wait for my mother to move in.
I'm with you on the family part. Trust me. I think we'll share stories on future caregiving needs we'll both have. So
Yes.
yeah,
And I'll put a link to your memory clinic in our in the description for the video so that folks can access that really easily. Well, thank you
Great.
so much, Max, for your time and expertise. And I'll see you in a future meeting.
Very soon. Okay.
All right. I'm gonna